To all. Members of the public, just a reminder that we have a lot of meeting materials. If you're watching online, hello, a lot of meeting materials that are on our committee website. A quorum is present. We're going to just dive right in. And I am going to ask, we have some minutes from the February 28th meeting of our committee. I may have a motion to approve those minutes. Ready up, Representative Kotyza-Witthuhn.
Mr. Chair, I would move approval of those minutes.
Okay, thank you. So members, additions or corrections to our minutes from February 28th? Hearing none, all in favor of approval of those minutes, please say aye. Aye. Any opposed? Okay. The motion passes. Thank you, Representative Kotyza-Witthuhn, and our minutes from February 28th are approved. Members, 3 bills today. The first one is from Representative Richardson, who I actually didn't see as I walked in, but I assumed, oh, there she is. And so glad to have you here, Representative Richardson. And members, the plan is to vote this bill out, have a vote on it, and then the remaining 2 bills, the plan is to discuss them and lay them over just to kind of make sure we're all on the same page. And so I will ask, I guess I'll ask Representative Kotyza-Witthuhn to move the House File 2095 be re-referred to the Committee on Health, Finance, and Policy.
Mr. Chair, I would move that 2095 be re-referred to the Committee on Health, Finance, and Policy.
Thank you. And then, Representative Richardson, would you like us to move the A1 amendment? Looks like just a small tweak to the bill.
Yes, thank you, Mr. Chair.
Okay, Representative Kotyza-Witthuhn, you willing to make that motion as well? The A1 amendment?
Mr. Chair, I would move the A1 amendment.
Thank you. Okay, so members, any questions regarding the A1? Just a small change. All in favor of approval of the A1 amendment, please say aye.
Aye.
Any opposed? Okay. And that motion passes. And 2095 as amended is before us. Representative Richardson, thank you. Please present your bill.
Thank you, Mr. Chair. House File 2095 modifies several provisions related to prenatal substance use. This bill seeks to bring Minnesota mandatory reporting laws into current alignment with best practices and medical research, and to help encourage people to seek out necessary prenatal care and treatment. Under our current system, providers are required to report to Child Protection when a person is pregnant and has a positive toxicology test for a controlled substance, including THC and alcohol. Additionally, the statutory definition of neglect relies on positive toxicology results and withdrawal symptoms as arbitrary measures of whether neglect or harm to the child has occurred. Toxicology tests are often redundant to known information about prenatal substance exposure. They are not consistently reliable and can be interpreted incorrectly by child protection agencies and the legal system. Yet these tests are often relied upon when determining whether to accept a child protection report or to substantiate child maltreatment. These policies deter people who are pregnant and using substances from seeking prenatal care because they fear being separated from their newborn, which can lead to situations that the first time that a patient is being seen is when they're in active labor. When prenatal care is not sought, it increases risks of low birth weight and prematurity. While reporting to Child Protection is commonly believed by mandated reporters to be a pathway to obtain resources for families, it often results in unnecessary trauma and separation of the newborn from their parents. Ultimately, this leads to a lack of trust between patient and provider and decreased engagement in prenatal care. Additionally, reporting substance use during pregnancy contributes to socioeconomic and racial disparities in health outcomes. Studies have consistently found that patients who are Black and Indigenous are more likely to be tested and reported for prenatal substance use than white patients, even though people from all races and socioeconomic backgrounds have similar rates of substance use and addiction. This bill will ensure that a positive toxicology test or a person's engagement in SUD treatment will not form the sole or primary basis for reporting a pregnant person to Child Protection or to substantiate a maltreatment determination against a parent. It states that toxicology testing be used for the purpose of providing medical treatment. It also establishes that there must be a nexus between prenatal substance use and harm to the newborn's health and safety and development, as determined by the caring physician, to file a report to Child Protection or to substantiate maltreatment. It also requires that physicians get informed consent to test the pregnant person, not the newborn, and an exception would continue to exist for emergency situations. So with that, Mr. Chair, I would like to turn the time over to the testifiers.
Thank you, Representative Richardson. And you've got Dr. Todd Stanhope, I believe. If you can please identify yourself and proceed.
Yes. Thank you, Chair Pinto, and all the members of the committee for hearing this bill today, as well as to Representative Richardson for her authorship of this file. I'm Todd Stanhope, a practicing OBGYN in the Metro, and additionally, I serve as the chair of the Minnesota Perinatal Quality Collaborative and as a member of the Legislative Committee of the American College of OBGYN's Minnesota chapter. It is my privilege today to speak to you on behalf of these organizations, as well as the coalition of stakeholders who have contributed to this bill. While I will share some additional details about this bill, what I most hope to convey are the following three things. First, that through the important work of the Minnesota Maternity Mortality Review Committee, we know that 1 in 3 pregnancy-related deaths in Minnesota is impacted by substance use. Secondly, we know that medical treatment of substance-exposed pregnancies results in the best outcomes for our families. And finally, House File 2095 represents the work of a broad coalition of stakeholders and is a logical next step in the work we are doing in Minnesota to improve the outcomes for our substance-exposed pregnancies. A bit of additional background. In 2021, the legislature passed bipartisan legislation that encouraged pregnant patients with substance use disorder to participate in prenatal care by creating an exemption to mandatory reporting in the setting of pregnancy for those who are engaged in prenatal care and treatment. Over the last year, the Minnesota Perinatal Quality Collaborative has led a collaborative of 12 Minnesota healthcare systems to implement best practices as shared by the Minnesota Hospital Association and in follow-up to the 2021 statutory changes. There is much engagement from the Minnesota healthcare providers in optimizing the outcomes for these pregnancies. In parallel, the Minnesota Children's Cabinet prioritized perinatal substance use disorder, and in doing so, it charged the Casey Family Programs to engage a multidisciplinary coalition to help improve outcomes. The bill today reflects this partnership, and it includes input from myriad stakeholders, which includes the Institute to Transform Child Protection at Mitchell-Hamlin, Adult Representation Services at Hennepin County, obstetrical and newborn providers, Equal Law Center, DHS, the Governor's Office, and many others. The bill modifies existing statute with the following 3 goals in mind. First goal is to continue to increase participation in prenatal care and treatment for those pregnant individuals with substance use disorder. The prior statutory requirements created a barrier to this relationship by requiring reporting. The current proposal further refines the 2021 statutory change and incorporates the last 2 years of experience within our state, as well as incorporates our current understanding of clinical management of substance use disorder in pregnancy. It, however, does not preclude a provider from reporting a patient when safety concerns are present. The second goal is a thoughtful approach to toxicology testing during the setting of pregnancy, insofar that it is done transparently and reduces the risk for false positives that result from the over-reliance of testing in the current setting. The proposed language will provide transparency to patients when toxicology testing is conducted and balances the testing of allowing for testing for clinical indications, which are relatively uncommon, with the need for balancing the indications for testing for the purpose of reporting to Child Protective Services, which is the more common indication for testing in our state. The final goal is a revision of the definition of perinatal exposure to substances as neglect. The proposed language enables a shift from reporting in the setting of an isolated positive result, which may or may not represent a false positive or result of medical administration of medications, to encouraging a more comprehensive safety evaluation for our patients and a plan of safe care. Many thanks again to this committee for hearing House File 2095, and again to Representative Richardson for her authorship. I'm glad to assist with any questions now or in follow-up to this committee meeting.
Dr. Stanhope, thank you so much for your testimony. We'll have questions once we're done with testifiers, so please stick around. I know we have one member of the public who signed up. If you can please proceed to the front. Elena Niehoff, not sure if I'm saying your name correctly. And yeah, we'll just, you can please identify yourself. Ask you to keep your remarks to 2 minutes if you can, please, and then please proceed.
Thank you. Mr. Chair and committee members, my name is Elena Niehoff. I'm from Rochester, Minnesota. I would like to express my concerns over the bill HF 2095. This bill changes word a woman for a person, implying that even a man can get pregnant. It is the blatant disregard of biology, anatomy, and physiology of human beings as God's creation. Only a woman can get pregnant. There are only 2 types of chromosomes in the human body, XY chromosome in the man's body and XX chromosome in the woman's body. There are trillions of cells in the human body, and all of them contain only 1 type of chromosome, XY or XX. You can prescribe hormone therapy, but you cannot change every chromosome in every human cell in the human body. As the great American sociologist Philip Reeve argued, American society is in the midst of an unprecedented experiment in building society apart from religion. One of the primary ways we have done this is by overthrowing the Judeo-Christian value of sex and gender. By under-tething sex from marriage, we have enabled the normalization of hardcore pornography, extramarital affairs, explosive growth of sex-transmitted diseases, death of 60 million babies in the wombs, and divorce epidemic. And by severing gender identity from God-given sex, we will likewise reap psychological, social, cultural, and political whirlwind. The standard of the word is the word of God. Please vote no on the bill HF 2095. Thank you.
Thank you for joining us. Are there any other members of the public who wish to testify on the bill? And so doesn't appear to be the case, and so we'll move to member questions or discussion. Members? Representative Kotyza-Witthuhn.
Thank you, Mr. Chair, and thank you, Representative Richardson, for bringing this bill forward. I think it makes a lot of common sense changes. I think my question might be more for your testifier. I'm curious just kind of what the most common process is, like for somebody to be going through a toxicology test, because does the person have to be showing signs of substance use during like their regular prenatal visits, or like in order for them to get a blood test at that point, or is that just like a really typical thing that happens with every pregnancy or delivery?
Dr. Stanhope.
Yeah, thank you so much for the question. I think this really gets at the heart of this bill. The current statute requires that testing is done within 8 hours of delivery when obstetrical complications are present. This has been broadly interpreted, and facilities across the state have used myriad indications for toxicology testing, as well as the timing of when that occurs. Through the Minnesota Prenatal Equality Collaborative, we've partnered with institutions to have greater alignment to focus on true obstetrical complications and have them be similar facility to facility. So in short, the practice is varied and stands to benefit substantially from the language as well as alignment among our facilities.
Representative Kotyza-Witthuhn, follow up? No? Okay. Representative Lee.
Thank you, Mr. Chair, and I just want to thank Representative Richardson for bringing this bill before us. I wanted to double check that I heard this earlier, that I think, is it a third of maternal mortality cases can be attributed to this? Can you just explain that a little bit more? I have a follow-up. Just want to make sure I heard that stat correctly.
Not sure if that was to Representative Richardson or to Dr. Stanhope.
Whoever could.
Yeah, so
Dr. Stanhope.
So the Minnesota Mortality Review Committee reviewed all pregnancy-associated deaths that occurred in 2017 and 2018. The causes of death are myriad and complex for many of those patients, but as I stated, in 1/3 of those, prenatal substance exposure was a component of that. So it is perhaps not the sole cause of each of those deaths, but is a significant factor in each of those deaths.
Representative Lee, follow up.
Sure. No, I appreciate that. And I just, I'm very surprised about the statistic. I have previous experience working on addressing maternal mortality, and I didn't know that this was, a big factor, especially here in Minnesota. So really appreciate this really important public health policy change that we're trying to make if we want to make sure that mothers and babies are healthy and continue living after birth, which is a very traumatic health event. I think this is a really important policy change we have to make so that people who need healthcare have, are not scared to access it and are not scared to tell their providers, their current situation. So thank you.
Representative Hudson.
Thank you, Mr. Chair. I wanted to speak to the point raised by the testifier, Ms. Niehoff, and thank you, Ms. Niehoff, for coming and making the point that you made. I like what you're trying to do with this bill. It's important that people who need care seek it and that it's accessible to them. It's unfortunate that that goal is distracted from by the effort to, well, not the effort, the actual crossing out of women and mothers, which by my count, and there may be more instances than I was able to find, 10 different occasions in this bill. In fact, you missed one, line 414. There's still pregnant women referenced, so you might want to amend that to further erase the identity of women as the human gender that is mothers. This is important. It's not, I refer to it as a distraction, and it is a distraction from what you're trying to do, but it's important to make this point that how people choose to identify is entirely up to them. But when we are regarding facts in the conduct of government, we need to be acknowledging reality, biological reality, factual reality, truth. Mothers are women. Pregnant people are women. Pregnant people are mothers. These are all facts. The fact that we have to have a testifier come up here and just state basic biological reality is a sad testament to the state of where we're at as a culture. And the point just needs to be made. And I know that we don't all agree that basic biological facts are something that should be acknowledged in our public discourse, that affirming people's feelings, affirming people's claims is more important than stating what is true, but it's not. It's not more important, and it never will be. Thank you.
Representative Richardson, any comment on that,
Oh, thank you, Mr.
if you wish?
Yeah. Oh, thank you, Mr. Chair. The point of the bill is to ensure that people with the capacity to get pregnant have access to the services and support that they need, because right now what is occurring is harmful to all involved, and so that's the goal of the bill.
Okay. Representative Davis. Oh, I'm sorry. I'm sorry. I think Representative Zalesnikar was first. My apologies. I missed that. Representative Zalesnikar.
Thank you, Chair Pinto, and thank you, Representative Richardson. I just want to echo, I agree with making sure we care for people with substance abuse. I am disturbed, however, that we are tying in with the goal that Representative Richardson just said, the capacity to get pregnant. The capacity to get pregnant rests with being a woman. I'm quite sure you, Chair Pinto, have not delivered a baby or went in for prenatal care, nor will you ever. And so I think that's a basic thing to be able to say as a legislative body who a pregnant woman is. And I find it completely offensive, having delivered 2 children, that we are at an elementary level of not being able to define a pregnant woman when we want to serve pregnant women. And I I'm not interested. That should be a bipartisan ability to do, to have that type of distraction from what this is about. I am not against what this is about. What I'm against is pushing a platform that is not necessary for the doctors to deal with or anyone else on what this goal is. And the fact is, nothing's going to change by how we want to identify on who is able to carry a baby and deliver a baby and receive care for a baby in the womb. So we say follow the science, but we don't get to select when we do that and confuse children, because we are a legislative body with people watching this, children and families across the state and country. That is a misrepresentation of complete fact. And we are about facts, and to say that is disturbing to me. It's offensive as a woman. It violates everything we've been taught in biology when we talk about education and the foundation of what we are as a man and a woman. And how we identify is not who becomes pregnant. It's two different things. And for that reason, I couldn't support this. This is language that is very confusing and obviously has a different motive than what the intent of this is. And so I hope that this body will consider that. Thank you.
Thank you, Representative Leitzinger. And I guess I'll say, want to be careful about people's motives, right, as to what the goal is, because I could imagine somebody might disagree with you about the motive being in conflict with the bill. Obviously, we'll let Representative Richardson get to that in the end. Representative Davis is up next.
Thank you, Mr. Chair. Today in the year 2023, this is a very sensitive subject, and I'm sorry that this bill doesn't have to be controversial, but it is, and it's one side making it controversial. And in my opinion, it's not the side that I'm on. This is a question that's been going around this nation now for the last year or so. Representative Richardson, I would like to understand what your definition is of a woman. Can you define a woman for me?
Representative Davis, the words being struck from the bill, so I'm wondering a little bit about sir,
There's still the word woman in the bill, sir.
Okay, well, I'll let Representative Richardson. I mean, I'm just trying to understand sort of the relevance to this. But Representative Richardson, I'll let you comment if you wish. Yeah.
Thank you, Mr. Chair. I would just reiterate that this bill it's about people, and it's about ensuring that people have access to the supports that they need.
I mean, so Representative Davis, I'll go back to you, but yeah, I'm wondering a little bit about her definition. I mean, we're looking at the bill in front of us. But Representative Davis, yeah, please.
Thank you, Mr. Chair. I'll ask the question this way. No, I won't. You did not answer my question, and that's fine. This bill is about helping people. We all sitting in this room want to help people. And I guess I'm sitting here discouraged that there has to be controversy around the definition of a woman versus definition of a pregnant woman or a pregnant person. I grew up being taught that science was a woman was someone who was born with female body parts. And I was brought up being taught by science that a woman has two X chromosomes and a man has XY chromosomes. And I just don't think that we should be changing those things, those facts, when it comes to government. Thank you, Mr. Chair.
Thank you, Representative Davis. I'm going to call Representative Hemmingson Yeager, and then would like to, hopefully we can be done at that point, and we'll like to Lee Daniels, of course, and then Representative Richardson, but Representative Hemmingson Yeager.
Thank you. So I have 2 points here. I have a master's in genetics, so I just kind of want to remind people a little bit about biology. My first question goes towards testing and scientific protocol. So would you say that the initiation of a toxicology test following delivery is a subjective way of doing things?
Dr. Stanhope, I'm guessing is that was directed to. I'm not sure, Representative Hemmingson Yeager, Dr. Stanhope, was you hoping to get that?
Yeah, probably be more
Okay.
appropriate.
If
Yeah,
you say,
I
if you, yeah, Dr. Stanhope.
I would say there are clinical indications, some of which are objective, some of which are subjective.
Okay.
And Representative Hemmingson Yeager.
Thank you. So that's kind of my point is being a white woman going through 2 pregnancies, I don't recall needing any sort of toxicology tests. So that kind of just is a concern to me that we are administering these tests with some, inherent subjective bias. My second point comes to genetics and biology and chromosomes. Having studied genetics, having taught biology, having taught anatomy, there is a traditional thinking that there is one X chromosome, one Y chromosome. There's a tiny little G on the Y chromosome, the testes determining factor, and that's what determines you are male. That is not really the case anymore. There are all sorts of ways your chromosomes can split. They can split unevenly. You can have an XO genotype. You can have an XYY, an XXY. You can have all sorts of myriad of genetic splitting with chromosomes, just like any of the autosomes. So you have your sex chromosomes X and Y. You have another 22 pairs that are called autosomes, and that's what gives you your hair color, your nose shape, your height, your interests, all those other things. So to say that gender, which is an identifying term, is determined on solely one gene on one pair of chromosomes is inaccurate. There has been more science and more genetics too that is looking at the factors acting upon those genes. So there's a lot going on in the genome that we don't know about. And to narrow it down to say that you are a man or a woman just based on this one characteristic is inaccurate. I think Representative Richardson said it accurately, where if you have the capacity to become pregnant, that is what you're treating when you're treating the body. So, and to deny health care because someone else's definition of an identity does not match that capacity, we cannot be denying healthcare because of that.
Thank you. So Representative Hansen had raised your hand. And Representative Hansen, I'm going to have you keep it really short if you can. Because we've got 2 other bills up that have to do with child care regulations, which you may have noticed sometimes occasional lot of discussion too. Representative Hansen.
Thank you, Chair Pinto. And as one of the only present members of the LGBTQ caucus, I need to make sure that I make a comment here because there are people listening and watching, and this matters. And I just want to go on record as reminding us that trans people have existed forever, and they will always exist, that some trans men and non-binary people can get pregnant, and not all of them, and not all women can get pregnant. The semantics and irresponsible rhetoric are wrought with just misinformation. Distraction's a choice, but so is inclusion. And so I want to thank Representative Richardson for looking out for everyone, babies, parents, and make sure that all kids in Minnesota can have a great start no matter who their parents are. So thank you for that.
Thank you, Representative Hansen. Representative Zelinsky, I know that you raised your hand again, but I think we do need to keep moving. So Representative Lee Daniels, we'll go to you.
Thank you, Chair Pinto. Thank you, Chair Richardson, for being here. I have to disagree on the bill, as my colleagues have already said very well. We go back to the biblical times and Adam and Eve, and nothing in the biblical realm has ever been proven false. And I just hold firm to that creation was made by God, a man and a woman separate. And you can have all the scientific data to show one thing or another. It doesn't really, I still don't think it proves that a man can get pregnant. That's kind of my point. This has been a real good discussion to get this open. My concern is actually on the safety of the baby during the pregnancy and after birth. So I was going to ask Dr. Stanhope, how many, you mentioned some of the tests that came out, the toxicology tests didn't come out all the time. They weren't correct all the time. Could you kind of elaborate on that a little bit for me?
Dr. Stanhope.
Yeah, I would be glad to, and thank you for the question. So any test that we do in the healthcare setting has inherent false positives, and each has a different rate among the test. There are, for example, false positives that can occur due to provider administration of opioids, such as, to assist with pain relief during labor. There are, for example, other chemical substances to which the patient may have consumed or been exposed, which are not illicit substances, but may trigger a false positive within the test. There are, I think it's important to note, a number of different tests that can be used, which further complicates it. So depending on which manufacturer a healthcare facility chooses, the false positivity rate varies depending on that. So it is a complicated topic, and one where I think pivoting a focus from a single test, which may or may not be a true positive, to a comprehensive safety assessment for the newborn as being the key focus subsequent to this work.
Lee Daniels, follow-up?
Yeah, thank you for that answer, Dr. Stanhope. It's just scary when we get into the, I've seen so much language of this crossed off in this bill, and it appears to me a lot of it is for safety of the child, and reporting issues where they have to report for 72 hours and used to be immediate or phone call or something like that. And my concern is with the safety of the mother and the child, and I'm glad we're doing something to help the mothers that give birth and have maybe a drug addiction. But it worries me that we're not really, fully testing the babies for what health conditions they might have, and maybe that's down the road, I'm assuming. Anyway, that's my stance on it, and I wish we didn't have to have the conversation about a birthing person. That kind of distracts from what the bill's intent, I think, is for. And I hope that as this bill goes through, we can make some amendments to it and go from there.
Thank you, Lee Daniels. Real quickly, just a question from you, Dr. Stanhope. Can you share best practice from your perspective regarding the kind of care for somebody who may identify as trans or otherwise? I mean, in your view, as somebody who's a professional in this area, does this change to say pregnant person, birthing person? Is that helpful from your perspective as a physician?
Yeah, thank you for the question, Chair Pinto. And from our perspective, we care for anyone who comes to us. And I think for healthcare providers, that's pretty straightforward.
Thank you so much, Doctor. And I don't want to have my desire to keep moving on this to be misconstrued. I really stand with Representative Hansen's comments in particular, and with all Minnesotans, and disagree with a number of the comments from my colleagues. I appreciate the conversation that we've had. I'll just point out that women and mothers are people, and so this bill absolutely includes the people as it did before. Make sure that it includes everybody. Representative Richardson, final comments from you.
Thank you, Mr. Chair, and thank you, members, for the discussion as well. I think that we have a real opportunity here to continue to build on ensuring that we are developing a system that encourages people to get the help that they need, to get prenatal care early, knowing that it can reduce a number of pregnancy-related complications, including prematurity and low birth weight, and ensure that families can stay connected. And we know that when families have the ability to stay connected and complete treatment, the outcomes are better. So thank you for the opportunity to present this bill, and would just ask members for support.
And thanks for your hard work on this bill. I know you and a number of other people have been working on it for quite a while, and appreciate that. With that, Representative Kotyza-Witthuhn renews her motion that House File 2095 be re-referred, House File 2095 as amended, be re-referred to the Committee on Health, Finance, and Policy. All in favor of that motion, please say aye. Aye. All opposed? No. Okay. The motion passes. The ayes have it, and House File 2095 as amended is on its way to Health. Representative Richardson, thank you so much, and Doctor, thank you to you as well. So members, moving on to Representative Coulter's bill, House File 2029. The next two bills both relate to child care regulation, so I wanted to kind of hear them in succession. Representative Coulter moves that House File 2029 be brought before the committee, and there are no amendments, I believe, and so we can just dive into you presenting your bill. Representative Coulter.
Excuse me. Thank you, Mr. Chair. I should note at the outset that we did have a testifier signed up who unfortunately fell ill, and literally every other backup was otherwise disposed. So I will only have one testifier on the bill. Excuse me, I'm distracted by my phone. So thank you, Mr. Chair. We spent a lot of time in this committee, maybe even the majority of our time, talking about the challenges that our early care and education system face. And most of that discussion really has been focused sort of on the funding side. And I obviously want to be clear that, and I think there has been sort of a bipartisan acknowledgement that there is a real need for more money in the system. But today we are continuing that conversation by focusing on the policy side, and that is where House File 2029 comes in. So House File 2029 addresses certain components of the oversight that the Department of Human Services provides to child care providers to ensure that they are meeting health and safety standards. And I feel like it's important to state at the beginning here that when we think about these kinds of things, these kinds of issues, that the focus really needs to stay on the needs of the kiddos. And I say that because it's really easy for these conversations to sort of devolve into everyone going into their own corners and assigning blame, when the reality is that we're all on the same side here. We're all on the kids' side, right? And then the last piece that I wanted to add before I sort of walk through the bill in broad strokes is that I know that there are some concerns about the language in this bill from a few different quarters. In particular, I have heard from DHS with some current concerns about how this might affect their work on the child care regularization modernization project. And that is a large and certainly needed effort. And my view on this bill is that it supplements but does not supplant that work. I think the issues that are raised and addressed in this bill are important ones that we've heard directly from providers about, like I said, very important to address. But I am certainly more than happy to work on the language to make sure that at the risk of mixing metaphors, that we are all rowing the boat in the same direction. So just quickly to the bill. Section 1 makes a relatively small language change to just sort of add some specificity when it comes to conditions flagged by correction orders. And it also states that in situations where these issues don't imminently endanger the health, safety, or rights of the child, that technical assistance is really the more appropriate approach there rather than a correction order. But it does allow for a correction order if that issue is not addressed. And then the following three sections are a series of directions to the commissioner. Section 2 provides for a standardized set protocol, so to speak, related to family child care provider and child care center inspections, and some of the stakeholder engagement involved and necessary with this piece is funded with a $50,000 appropriation detailed in Section 5. Section 3 provides for ensuring that the definition of education just really encompasses sort of a more fulsome range of educational backgrounds that folks might have. And Section 4 provides for a staffer within the department to serve as a liaison for licensees on the background study process. And so my testifier can get into sort of more details and the nature of the language there, but all of these pieces, I think, are just really, really critical at getting at some of the issues that we know are causing consternation and even sometimes raising costs for providers. And so I think moving this bill forward will ensure that they're addressed. And so with that, I think I can turn things over to my testifier.
Okay, Mr. Burke, please identify yourself and proceed with your testimony.
Good morning, Chair Pinto and members of the committee. My name is Sean Burke. I'm with O'Connell Consulting, and we represent Isaiah and their Kids Count on Us coalition. That coalition is a group of over 500 community-based child care providers that includes both licensed child care providers and licensed family care providers. And we want to thank Representative Coulter for bringing this bill. Child care providers work under a licensing system of statutes and rules that are in some cases over 30 years old. And so we are very excited about the modernization project that Representative Coulter alluded to, but that project is not due to have recommendations out until next year and may not be fully implemented for several years after that. So the reforms proposed in HF 2029 represent reasonable steps to ease some administrative burdens now. We see this as a complement and a prelude to the modernization process. We know that many of you, when you've talked to childcare providers, it's not uncommon to speak to a center director, for example, who is the front desk worker, the lead teacher, the cook, and the cleaning staff. And they are all of those roles by 10 a.m. For family providers, they've been doing that since the start of the licensing process. And the time for dealing with time-consuming licensing-related issues comes very much later in the day or later in the evening. So Representative Coulter nicely walked through the overview of the sections. I want to go through them with just a few examples to kind of bring to life why these changes are important to make now. So again, Section 1, there are 2 changes. At line 1.18, we have found that there's a tendency in correction orders for licensors to write more conclusory statements. For example, a violation of one of the rules is the equipment is not in good repair. But if you only see that language on the correction order, how are you really going to get at the problem? What we really want are licensors to say something like, 3 of the 4 toddler toys in room 3 showed visible signs, including fraying on the cloth book. Right? That actually helps give the specific observed facts that give rise to the violation. And when correction orders contain that information, it's a lot easier for providers to actually fix the problem. The second change really brings some common sense to the correction order process. Correction orders are one way in which DHS can license and implement the rules, enforce the rules, but they are naturally flexible. Current law in 1.12 allows the commissioner to permissively give correction orders. What the change would do here is for the first violation, it would be technical assistance, and then the subsequent violations could continue to issue a correction order. Earlier this year, we had a couple of providers in our coalition who noted that one of the rules is that the center's temperature cannot be less than 68 degrees. In a family center and a family home, that's 62 degrees. And so if the licensor sees it's at 65 degrees on the first time, they can issue a correction order. And correction orders are not appealable, and they are public record, and they are time-consuming and burdensome to deal with. And so we believe this is a common-sense approach that truly doesn't undermine safety in any way. For Section 2, what it asks the department to do is to work with stakeholders, and there is an appropriation, to develop some standardized guidelines and standards around what providers, both in the family care setting and in the center setting, can expect from a licensing visit. It's not uncommon to have one licensor one year tell you, hey, I need all of these documents snail mailed to me. Or another licensor to say, I only respond by email. And many providers have rights during this process, including the right to an exit interview, and it's unclear where in the process they are ever told or informed of those rights and how they can use them. So if Section 2 is implemented, we'll have a full standardized process of what both licensors and providers can expect. Section 3 brings some clarity.
Rick, I'll ask you maybe in a minute if you can wrap up, just in a minute or so, these next 2 sections.
Perfect.
Next couple.
Section 3 brings some clarity to a very confusing part of the statute. Again, written over 30 years ago, there's some education requirements that count as one part of a teacher's credentials. And under current interpretation, classes in college like photography or typing could count as credentials, but your intro to biology class won't count. And so we're asking the department to relook at those standards and make it a lot easier for teachers to become licensed. And finally, Section 4, this is a common sense approach to background studies. If you've talked with a child care provider, I'm sure they have raised the problem of long delays and backups in background studies. Child care background studies are very complex, and it makes sense that the department should appoint a liaison, someone who only works in child care background studies and can be a point person for the providers and also inform the department about when some key changes are needed based on what they're hearing on the ground. So that's the bill. Again, thank you, Representative Coulter. Thanks for the time, and I can stand for more questions. Thank you.
Thank you, Mr. Burke. And I'll just note, and then section 5 is the $50,000 for to develop and implement the timelines, et cetera. So, okay, good, thanks. I see Representative Zalesnikar, I think, had her hand up, so may have been wrong about that.
Thank you, Chair
What
Pinto,
about you?
and thank you. I can't see you. Thank you, Representative. I have heard a lot about the process for licensing, and I totally agree that this is very, very important. And I like the fact that they have technical, they give technical assistance, and then it sounds like the process is correction orders. My question is there ever a step where there's a fine piece to this, or is it just correction orders? I just wanted to ask that question.
Representative Coulter, Mr. Burke, yeah.
Chair Pinto, Representative Zalesnikar, yes, correction orders are just one enforcement mechanism, and the department does have fining authority. They wouldn't necessarily have, they don't have necessarily fining authority for the first correction order in current statute.
Representative Zalesnikar.
Thank you for that clarification. Do you have any data on the amount of fines that we have issued in the state of Minnesota in the child care realm for family and centers?
I suspect these folks may not, but we may have somebody you can try to help answer that question. I'm just, and obviously feel free to answer. Well, Mr. Burke, yeah, okay, let's not have either of you. Okay, good, right? We've got folks from DHS in the room. They may not have that information. I'm not sure what Ms. Mock may have for us. Anybody feel like they can answer? Nope, Ms. Mock is not able to at this time. Oh, okay, Mr. Hosh, yeah, if you're able to, yeah, or at least start us on the process. Yeah, please identify yourself.
Thank you, Mr. Chair. Larry Hosh with the Department of Human Services Licensing Division. We can definitely get the committee the information that Representative Zalesnikar requested from correction orders to fines and also other technical assistance. All our activities, including technical assistance, is public record that is posted on the licensing information lookup. So just wanted to clarify that for the committee.
Thanks so much, Mr. Hosh. And as long as you're up there, I'll just note to members that Mr. Hosh was scheduled to provide a presentation to us on the regulation modernization project earlier. We had to have that bumped, and I don't know if we'll have time for that specifically, but he, I know, is available, and the department is answering questions, and that project is in process. So thank you, Mr. Hosh. And Representative Zalesnikar, follow up? Yeah, please.
Thank you, Chair, and thank you, Representative. Thank you for that information. I'll wait till you get that to the chair and to us.
And we'll send it out.
I
Yeah.
appreciate it. I am thrilled to see that it's a technical process, a coaching. It sounds to me like it's a collaborative thing on corrections, and I'll wait to see what the fines and what the numbers look like. Thank you.
Thanks, Representative Zalesnikar. Yeah, thank you, Mr. Hosh. Other members, Representative Hudson.
Thank you, Mr. Chair. Representative Coulter, on line 118, you insert specific factual in reference to reasons cited for a conditional license. And as has been noted a couple of times during testimony, these are matters of public record. And so I have a couple of examples here of letters that were received by child care centers informing them of their conditional license status. And, they list, I'm not going to go through the whole thing here, but they list the number of violations, the number of repeat violations, and then they outline specifically what those violations were. What's the problem that language is trying to solve? Are there non-factual citations that are being considered in the issuance of these conditional licenses?
Mr. Burke or Representative Coulter, either one of you?
Well, I can
Coulter.
start with that, and I think Mr. Burke can fill in the details. I think the sense that I'm getting, and I mean I've heard this from providers as well, is because so much of this varies from licensor to licensor depending on who's doing the actual inspection, that some licensors are do a much more thorough job and lay out specifically what the issue is. And, to the point that Mr. Burke made earlier, some do not. And so I think it's really getting at more just clarifying what the expectation is when these things are noted, rather than saying, sort of wagging the finger and saying everybody is doing this wrong. I don't know if Mr. Burke can expand on that.
Mr. Burke as well, and then.
Chair Pinto, Representative Hunsid, yeah, I think it is an important clarification, and I would put the emphasis on the specific rather than the factual. On The way in which a provider would see this is after a licensing visit, they'd get a correction order, literally a document, a piece of paper, essentially a notice telling them that they need to respond. They can't appeal it. They can ask DHS to reconsider it, but that is not really any sort of even quasi-judicial process. And the problem is a lot of times when you read through what the violation was, you will see things like just restating what the rule was. Equipment was not in good repair. Well, that's right from the rule. But that doesn't tell me anything about what you actually saw and what I need to change. And so we're asking licensors to take that extra step to get more specific so that, as Representative Zelensnikar said, really this should be more of a collaborative learning process. And we would expect this to happen both in the TA and if they ultimately do need to correct. So that's what the emphasis is about there.
Representative Hudson, follow up.
Thank you, Mr. Chair. So would a notation such as one listed here that says failure to keep hazardous items away from children, would that be regarded as specific enough?
Mr. Burke?
Chair Pinto, Representative Hudson, at the risk of putting my attorney hat on, if I was representing a provider in that circumstance, which I don't do in my practice, but if I was, I'd say no, because what does hazardous mean? Is that dish soap? Was that chemical peroxide? And where was it? Was it in the back room? So just give a few more factual details. Again, the purpose is not so much shouldn't be punishment here. Even the name correction order implies we should be doing some teaching and coaching and some technical assistance so that the problem can be fixed and moved on and shouldn't be focused as much on punishment.
Representative Hudson?
Thank you, Mr. Chair. And just one more question. Similarly, there's language stating that a violation should be observed by the licensor, and I'm wondering what the intention is there. Would that preclude a violation that is recorded on, say, a closed captioning system and then later noted by an authority, or would it preclude a violation that's observed by somebody who isn't the licensor, but then reports that to the relevant authority?
Mr. Burke?
Chair Pinto, Representative Hudson, that's a great question, and I think the intent of this is that it's not just third and fourth hand information, but I do think, and in the spirit of what Representative Coulter said, we are working with the department on this language. It may be that the word observable rather than actually observed is probably more proper there. And that's the type of work that we're continuing to engage on. So thank you for your question.
Nothing further. Okay, thank you. Yeah, and it does occur to me that part of the reason to be specific is that if these do become public, if I'm a parent, I want to know, what the deal is, what the actual situation is. I saw Representative Zelensnikar, I think, had a follow-up, I believe.
Thank you,
Yeah.
Chair, and thank you, Representative. I just appreciate that we're going to take away some of this burden from the child care providers, because I think that, to your point, there's a lot of subjectivity when we have surveyors coming into child care and other licensed settings. And so if we're not in a coaching education moment to help the providers raise the bar, then we're really punitive. And I appreciate the direction of not being punitive, because I think that's going to foster a atmosphere where we have providers in family child care and in center child care, which is the goal, to have access for children and have great programs happen. And I think there's a better way, and I appreciate that commentary of what the goal is and to have specifics, because you have to look at scope and severity. Words can mean different things. And so the specifics and going that road, I appreciate it and support this. Thanks.
Thanks, Representative Zelensnikar. And I think, and I'll note it's a balance, of course, and that's where the conversation is going to lie with the next bill as well, I know. Okay, so not seeing other comments or questions, I'll go to Lee Daniels as usual, and then Representative Coulter. Lee Daniels.
Thank you, Chair Pinto, and thank you, Representative Coulter, for bringing this bill. I think I like the intent of it. I'm just a little bit concerned on repeat offenders, I guess I'll say. There are several that have been cited I'll name one. Salama Child Center, 27 licensing violations, 10 of which are repeat violations. They include complying with background study requirements, failure to supervise children, and failure to maintain staff distribution. And I don't know if this is a question for Mr. Burke, but or maybe the DHS are those the people that are getting the fines? I mean, we don't have that information handy, but with those people, I'm guessing if they've been repeat offenders that many times on pretty serious, violations, that they would be due for a fine, due for a correctional. But anyway, that's my question. I don't know if we have an answer for that today, but
If I'm understanding it right, Representative Dan, if you're talking about a provider who's had multiple violations or egregious violations, then it seems like this would not apply to that because this is really referencing, there's no immediate endangerment, et cetera, et cetera. So I'm not sure that would kick in here. I don't know if Mr. Burke may have a comment about that or Representative Coulter, but.
Well, thank you, Mr.
Coulter,
I, to that point, I guess I would just point to the language on lines 2.4 and 2.5. And I should note, this language failure does not imminently endanger the health, safety, or rights of the person served by the program. I'm trying to find my notes now. That language is used elsewhere in statute. And I'm not finding in my... actually at the beginning of the bill, maybe if I'd read, in 245A.06. So I think that gets at the concern that you raised, Representative Daniels. And I would add as well, without knowing the specifics of the case that you're referencing, as Mr. Burke pointed out, background studies are a time-intensive, confusing, complicated process. And so I think, to the point of this bill, ensuring that there is somebody that at the department that folks can call who, they can address their questions and concerns to with regard to the background study may well address some of those issues as well.
Okay. Thank you, Representative Coulter. Lee Daniels, ready to move on, I guess?
I am good.
Okay.
I'm just concerned about there again and getting back to safety for everyone and
Yeah.
safety of the children that they're watching and making sure they have the background checks and those type of things. But that's it for me today.
Okay, so I should note that the testifier who's not able to join us, there'll be a letter coming from that testifier that'll be sent to all of us. Representative Coulter, closing words?
Yeah, thank you, Mr. Chair, and thank you, members, for the good discussion today. We had some good conversations today, and I hope and believe there will be more to come. As I just kind of want to reiterate again that this language, this bill is going to be laid over. We will have plenty of time to work on this language moving forward, even beyond this bill, of course, with the regulation modernization project, which is kind of a mouthful. But I guess in closing, I would just say that, the issues raised in this bill are individually the kinds of things that may not seem necessarily hugely significant, but I think we know that they all add up, right? Running a business is hard. Taking care of kids is hard. Running a business that takes care of kids is really hard. And we know that we need more child care providers, and we know that they need support. So I'm just really hopeful that we can get at a way to address the challenges that this bill is addressing. And I know that's going to require occasionally some difficult but very intentional conversations. But I'm really looking forward to them, and I think this bill moves us farther down that road. And so for that reason, I think it deserves to be included. Thank you.
Thank you, Representative Coulter. Thanks for your work. With that, the chair lays over House File 2029. And Representative Kotyza-Witthuhn, you're on your way up to present House File 2106. So Representative Kotyza-Witthuhn moves the House File 2106 be brought before the committee, and we'll give you a chance to get settled in, no problem. I believe that the same one of the testifiers who's going to be on your bill was, again, is not able to join us, but I think that there may be a letter, maybe that's going to be read by Mr. Griffin. So Representative Kotyza-Witthuhn, please present your bill.
Thank you, Mr. Chair and committee members. House File 2106 is child care licensing workforce flexibility package. We all know, and we hear all the time of the challenges currently facing almost every industry in our workforce with the worker shortage. And we know that, this isn't necessarily based on a lack of workers, but lack of support for workers in a variety of industries. And so that's particularly difficult in the childcare industry, knowing that wages and benefits are really difficult. So there's a number of policy changes that we are able to make in order to support childcare center providers in ensuring safety and enough staffing to keep our children safe and healthy as they develop. So I'll do a really quick walkthrough of the sections, and then yes, I do believe we have some written testimony that from one of our providers who was ill and wasn't able to join us today. So Section 1 would amend the definition of experience so that professionals with direct care experience with other vulnerable populations, not just children, so elders and in disability care fields, can count that experience toward our requirements that are currently in statute to obtain certain positions in licensed child care as an assistant teacher or a teacher. Section 2 adds language clarifying that providers can invite prospective employees to do working interviews in classrooms so that the candidate's interactions with children can be observed without that candidate having to have already cleared a background study for that provider. And we also have had conversations in this committee and also as well in the Human Services Finance Committee about the delays and the difficulties that some folks are having accessing the verified background screens, et cetera. So this is something that would be really beneficial, and it would also save providers time and money should somebody not actually be able to clear a background check, or if they are say like, you're not the person that we're looking for with that, and then not having to go through that entire process. So that candidate is not counted in the ratio and would be under continuous supervision of an employee with a valid background study. So that person, that candidate during that process would at no point be alone, unsupervised with any of the children in the center. Section 3 allows an aide to function as an assistant teacher during limited periods of the day. So that would allow an aide already in the center who's passed a background screen to be alone with a group of children. And Section 4 streamlines an existing process that allows early educators to earn and learn. So this language would allow aides or assistant teachers to be promoted to full teacher positions as long as they are concurrently enrolled in the Child Development Associate or CDA certificate program, which will qualify them to be a full teacher, and as long as they complete it within 1 year. Currently, providers must fill out a waiver request and paperwork in these situations, and DHS approves nearly 100% of these requests. So it just removes the requirement that waiver paperwork be submitted and allows providers to make those promotion decisions in order to help retain and grow their staff more quickly. So we have had a number of conversations with various advocates working with the Minnesota Child Care Association. I know that DHS did provide some technical assistance as we were working through the language of the bill. We've also worked with taken some feedback from the Elders for Infants group, and those conversations are still going forward. But I think that this bill as a whole would really just ease some of the burden on our child care providers as they work to support and grow their existing workforce and expand the current workforce. So I will allow Mr. Griffin to
Okay.
if that's all right.
Thank you, Representative Kotyza-Witthuhn. So, Mr. Griffin, please identify yourself and proceed.
Thank you, Mr. Chairman, members of the committee. My name is Phil Griffin, and I work for eWealth Consulting, and I'm representing the Minnesota Child Care Association. We appreciate the opportunity to support Representative Kotyza-Witthuhn's bill today. House File 2106. This is a package of licensing changes that has been brought forward after discussions with child care providers. While we are all aware of the overall workforce crisis, I think it's a catastrophe in this area, as well as a couple of other small areas, and we're looking for every piece of work that we can do to try and make sure that we deal with that crisis. And it won't be one silver bullet. It will be all kinds of things that you'll have to do to try and fix this, as you are all well aware. Our workforce after the pandemic is still 8% below what it was pre-pandemic, and we are working hard to try and fix that, but we need your assistance. The child care workforce is the workforce behind the workforce, and if you don't have child care, you don't have other workers. We urge you to support this legislation as it moves through. The bill would allow those with direct care experiences to be valued and welcomed into child care, while understanding that educational qualifications and early childhood content knowledge would still be necessary. Allowing aides to function as assistant teachers during pickup and drop-off times would give center directors more flexibility to ensure as many classrooms are staffed and serving children as is possible, while also helping to ensure that lead teachers are available for the bulk of the program day when most of the children are present. If you haven't been at a child care center during those passing times, I invite you to come and see chaos that makes house floor sessions look like a calm, engaging activity. Finally, removing the variance step to promote quality staff who do not yet meet lead teacher and education qualifications would allow providers to hire classroom staff faster. We commend DHS's partnership with these providers during these years of extreme staffing crisis. They understand our needs and are wonderful about approving these CDA variances. The problem is we hear from providers who say, yes, DHS is great about granting these variances, but since I have no staff, I'm stuck in a classroom or a kitchen all day and can't even find time to finish and submit the variance paperwork that is sitting on my desk. This bill would allow that director to make the decision, promote the staff to teacher, allow that staff to be paid a higher teacher wage, and enroll them in a CDA program without the additional paperwork. In closing, we can't support the overall workforce without our own workforce. We think this package changes some of those in a reasonable way. We will give providers some flexibility they need to run their programs. Mr. Chair, I really regret that you aren't able to have Maria here today. We will send her testimony, but she's much more enthusiastic than I am and would have provided you with a much better picture of what's going on in her child care centers. But she does send her regret. She is very ill, and I asked her, please stay away from me. I can't afford to do that. Thank you, Mr. Chairman and members. If there are questions,
Thank you,
Thank
Mr. Griffin. Yeah, and having interacted with Ms. Snyder through the years, I know really compelling presenter because she does incredible work with kids, and it shows. So thank you. Any members of the public wish to testify on this bill? Come on up. Oh, yeah, right. Yeah, Katie Williams, please. We'll get you settled in. And I will note as you walk up that there is a letter from Ms. Williams and Elders for Infants in the packet as well for folks to see. But please identify yourself. Welcome to the committee.
Thank you. Chair Pinto and members of the committee, my name is Katie Williams. I have spent 30 years directing child care centers in Hennepin County primarily. And I'm part of Elders for Infants. And we're an informal group of retired early childhood professionals from multiple fields representing early care, parent education, mental health, higher ed, child development training, and health care. And we're dedicated to making visible the needs of infants and toddlers from prenatal to age 3 and their mothers and fathers and extended families and caregivers. And we believe that Minnesota's prosperity depends on a sustainable system of care and support for families with young children. We are very appreciative and grateful to Representative Kotyza-Witthuhn for all the work she has put into supporting child care over the years, and we've made great progress. But you have our letter of opposition to this bill. We're very concerned about Minnesota's child care crisis. Families can't find child care, programs can't find staff, centers and providers are closing, early childhood programs in higher ed have been eliminated, and enrollments in existing programs have been going down. The reason for all of this is the very low pay that child care provides. We know that centers cannot afford to raise wages, and most young families cannot afford to pay more, yet we cannot afford to abandon the essential ingredient of safe, nurturing early care and education, which is trained, experienced teachers. Over my years in child care, I've been fortunate to observe teachers who draw on their knowledge of age-appropriate child development to establish nurturing relationships with each child in their care, and I've seen teachers calm a struggling classroom, and teachers make progress with a challenging child, and I've seen teachers who knew what to do in a crisis. This is not easy work. It takes training, experience, and depth of knowledge. The amendments proposed here to Rule 3 would lower the qualifications of child care staff and endanger the children in their care. We Elders for Infants feel that passing a short-term, crisis-driven fix for child care centers would put the field in a difficult position as we move towards sustainable compensation reform with salary schedules and defined credentials. We are excited to join in efforts to bring that about. But in the meantime, we urge you not to make any permanent changes reducing staff credentials. Thank you.
Thank you, Ms. Williams, and many thanks to the Elders for Infants, which full disclosure has taught me pretty much everything I know about early childhood. So I'm so glad to have you all, have you here. Thank you. Any other members of the public? So seeing none, some time to move to member questions and discussion. I think Representative Zalesnikar was on the list, so go to you first. Representative Zalesnikar.
Thank you, Chair Pinto, and thank you, Representative, for bringing this forward. I just had a question, and, you know, on a broad scale, I understand the intent of allowing people, because there's caring for people is a high burnout area for whether it's children, seniors, or disabilities. And so having ways to move between professions without losing caregivers to Walmart or something else because they're just tired, maybe they need another lane change. That's the part of this that I like, because it maybe is going to get exposure, keep people who have an understanding. I'm thinking that's how you're defining experience when you're looking at, but I'm not sure on that. When you're looking at what type of experience, are you looking at experience from the sense of people that have worked with other vulnerable adult groups, so they would understand vulnerable adults and to some of the point that the speaker up there is talking about now? Because my concern is just that balance of accessibility and getting people into the field, keeping people in caregiving professions, and then having a baseline of a bar of a standard that we all, I think, agree we want. If you could comment on your thoughts.
And before you do, actually, Ms. Williams, I'll have you return to back to the audience if you can. Yeah, thanks. If somebody needs you, we'll call you on up. But Representative Kotyza-Witthuhn to the question.
Yes, thank you, Mr. Chair, and Representative Zalesnikar. I think that that's particularly with the experience that you have in your outside of the legislature experience. I think that that's a really, really good point, and I think that's exactly what we're trying to do with this bill, because we know, people who go into these caregiving professions have a heart for this type of work, and it, I think exactly. Actually, when you were speaking, I had this flash of a scene from Grey's Anatomy in which one of the medical professionals wants to switch into pediatric work because she just wants to be around babies and kids and just like have that level of experience and joy in her day-to-day work. So I think that could be a very similar situation for some of our caregiving professionals who have worked with elders and they just really enjoy caring with people, but they want to be around little kids for a little while, and just kind of stay in the same realm. But we can count that experience because it's certainly, while it's not exactly the same, and there are different skills that you will learn and can transfer between all of that work. But yeah, so all of the section, subdivision 6B, so lines 1.12 all the way through the bottom of page 1 kind of gives a variety of different opportunities. So elderly or disabled adults, if you've cared for in a licensed child care center previously, in a public or non-public school, and all of those kind of previous experiences that kind of fall in that same lane.
Representative Zalesnikar, follow-up?
Thank you, Chair. Thank you, Representative. No, I have no further questions. Thank you very much.
Okay, thank you. Hudson's up next.
Thank you, Mr. Chair. Representative Kotyza-Witthuhn, I just wanted to give you an opportunity to address the testimony from Ms. Williams and the letter that we were provided from Elders for Infants. Assuming you've taken a look at it and taken under consideration, what are your responses to their concerns, and have you made any changes as a result of having been presented with that?
Representative Kotyza-Witthuhn.
Thank you, Mr. Chair. And yes, we have had conversations throughout the process with Elders for Infants, and in fact, we did make a change in the language process that included that 30-day. I'm sorry, I'm gonna have to figure out where this is. Yes, line 2.23, so that they have been serving in a child serving role at the center for a minimum of 30 days. So it's not as if somebody could walk into this role and never have had any experience with children. So they are, you know, in the process of learning and training, and they've kind of moved through that initial month, if you will, before they. So we added that in there with their feedback, and so I think that did ease some of the concerns. But I do see their point. As she had alluded to, we've done a lot of work together in the past on similar bills, whether they were licensing or other stuff. I do think that this bill is kind of a yes and. I mean, we know we've talked about so many times before that there's really not a silver bullet answer to any of the problems that are facing our child care industry right now. And so these licensing flexibility proposals would just go part of the way, I think, to help them attract and retain workers. And then we can, you know, at some of the other work that we're doing will kind of help ease some of the wages and benefits and all of that sort of stuff. So I think, yeah, it's a yes and I certainly appreciate their experience and suggestions.
And as I come back to your Representative Hudson, I'll just note, and I'll say more at the end of the hearing, but part of the reason to be laying this over today, as with the prior bill, is that there are these ongoing conversations. So, I mean, I'll say I as chair, there's some pieces that seem good, some pieces I've got concerns with, but it seemed like important to have the conversation. How child care regulation and early care and learning regulation is a big priority for all of us as an issue. But back to you, Representative Hudson.
Thank you, Mr. Chair, and thank you, Representative Kotyza-Witthuhn. Yeah, that's exactly what I wanted to hear, is just give you the opportunity to respond to their concerns, and I'm glad that it's being laid over and that the work will continue. Thank you.
Thank you. Representative Hicks.
Thank you so much. I do have a question about how, and maybe this is more for the department, when we're talking about experience and determining the experience, we've outlined what's considered experience. How do providers document the experience of their staff? Do they just keep that documentation? Does the department look at any of that? I know on the Medicaid side there's like enrollment, but I don't know how that works in the child care side. So I'm just kind of wondering, like, you know, if the person has been working with, you know, disabled adults and looking at that experience, do they get a letter from their previous employer? Like, how do we document that? How do we know about that?
I mean, they probably will toss that to somebody else. I'm guessing because if Mr. Hosh happens to, or somebody else is present who happens to know that and can help us. Otherwise, I suspect Ms. Mock can try to take a stab, though possibly. A bit of a shake of the head from Ms. Mock. Mr. Hosh, if you can, whatever you're able to give us on that would be helpful, and then if we need to get a follow-up message too, we can do that. So welcome back, and then any thoughts in response to that, Mr. Hosh?
Thank you, Mr. Chair. Larry Hosh, Department of Human Services Licensing Division. We have been working with the stakeholders on this bill, providing technical assistance. For the items of experience under the first section, we would likely have to do some forms for documenting that experience. But at this point, I think that's more speculative, and I can get back to our managers within the family child care and child care center units.
Maybe stay where you are, and we'll see follow-up questions possibly. Representative Hicks, that's fine, yeah.
So this bill changes those requirements, but the current statute says that experience is paid or unpaid. So how are we currently documenting experience?
Yeah, so Mr. Hosh.
Thank you, Mr. Chair, Representative. Currently, a variance process. A variance would have to be requested. The specifics that are included in that variance, I can't answer right now, but I can definitely get that information for the committee.
And that maybe confuses me a little bit, but Representative Hicks, I'll go back to you if you've got a follow-up.
Yeah, so I'm still confused. So right now in law, they have to have experience. How are we currently identifying their experience? Do the child care providers themselves just like keep documentation to show that their assistant teacher has whatever they're supposed to have and their lead teachers have whatever they're supposed to have? Or do they like submit stuff to the department, or like how does that work?
I think we're talking about the lines 1.8 to 1.11 on the bill, the kind of the original language, imagining it's not stricken out. This is the current law, and it defines experience. And I think Representative Hicks is asking, like, so then how is that demonstrated or measured currently, if you know, Mr. Hosh?
Thank you, Mr. Chair and Representative. I do not have the answer to that specific question. I know that this bill would require several forms to be updated. I'm assuming that has something to do with the new language.
Understood.
I will get back and get that.
Yeah, if we have DHS folks get back to us in answering that question, that'd be helpful. Representative Hicks, any further follow-up?
No.
Okay. That's helpful. Thank you much. Okay, good. So then I don't see other questions comments from members, so going to Lee Daniels as usual. Lee Daniels.
Thank you, Chair Pinto. And thank you to the testifier I don't have her name in front of me, Kate Williams.
Yeah, Katie Williams.
For coming down and testifying. When I looked at some of the changes that are being made, this is kind of a broken record, but my number one concern is safety, specifically safety for the children. So my question was, did this bill go too far? And by the testimony of elders and infants, it sounds like it did go a little too far. So I'm happy that Representative Kotyza-Witthuhn is willing to go and work with the stakeholders, and that's wonderful, because there has to be compromise. We just don't do enough of that in this body. Thanks to my colleagues, they have very good points throughout the discussion there, and I just appreciate the intent of the bill. We do need to get more people in the daycare field, but we can't jeopardize doing drastic changes if it jeopardizes the health and safety of the children. So that's my concern. Back to that health and safety.
Well, I think that's, thank you, Lee Daniels, and that's a great thing to be always keeping in mind in all that we do. So thank you. Representative Kotyza-Witthuhn, closing comments from you.
Thank you, Mr. Chair. And I appreciate the conversation today. I think there's so much more that we do agree upon in these areas in terms of regulation than sometimes comes out at the end. And I want to be clear that this bill, not the language in this bill, changes like ratios or anything like that. It just adds some additional flexibility to who can be with these existing ratio sizes and group sizes for children at their variable ages. Because I know that we have seen proposals previously that there was a bill before the committee last session that would allow teachers to take care of way more infants than they currently are able to, and that I think is where we really cross the line in terms of safety. So some of the regulation discussions that we've had in comparing the state of regulation in Minnesota in the early care and learning industry with the state of regulations across the border in Wisconsin and elsewhere, we know that those issues are not the driving force behind the overarching issues that we are seeing in early care and learning right now, because every state in the country is experiencing loss of providers, low numbers of staffing and all of that. So I think that this just very simply does give some additional flexibility to the providers in hiring workforce who has a heart for caring for children and other caregiving professions. So certainly appreciate the input. I am a mother of 4. I've had my children in a variety of early care and learning opportunities, both with our public schools. We currently are hosting an au pair, and then we've been in traditional child care centers as well. So I want to make sure that every family has access to something that that works for them, that's affordable and accessible, and just that we give support to our providers where they need it most. So thank you so much.
Thank you, Representative Kotyza-Witthuhn. And just a broader comment, I kind of building on what I'd said in response to Representative Hudson's question. So we heard these 2 bills today. There will be a 3rd bill coming up from Representative Coulter that is actually an agency bill, DHS child care licensing bill. It's 2330, so just to give a heads up to folks. And my hope is that we might be able to vote out a child care licensing bill, a sort of an omnibus policy bill. One question there is going to be make sure that none of those 3 bills have costs, and so maybe highlight that to Mr. Berg for us to address at a later time. But if they don't, and if we can work these details out, then that might be something that we could do, so that we would just be able to pass that on and have and address some child care licensing issues. So I guess I'll just encourage everybody, expect that that these may come up sooner than budget bills, possibly in some form, and that 2330 will be coming up as well. So members who are interested in this issue, please take a look at this, have conversations, so we'd be ready to kind of go when that comes. So I think we're all done with this then. So members, I'm laying over House File 2106 to be possibly brought up at a later date. And then members, we have got just a couple weeks left. Be looking for a little bit later today some announcements regarding hearings of next week. A reminder that next Wednesday at 6 p.m. we will have an evening hearing, and we may well have a hearing the following Tuesday, the 14th, in the evening as well after caucuses. Still finalizing that. We'll send that out. Any questions from members at all? And with not, this meeting is adjourned. Thanks.